Okay, so now we're gonna do Abby's talks, and we're gonna treat her glabella, her frontalis, her orbicularis oculi muscle, as well as her orbicularis oris for a little lip flip. One thing I like to always talk about with patients is anatomy, and everybody's anatomy is slightly different. So with her, you can see obviously she's young, beautiful, but she is starting to get those little tiny lines etched into the skin. So we're doing this more for prevention. Even though she is young, she's at a good time to start doing this. Another thing with her anatomy specifically, we talked about this, her eyelids are a little bit heavier at baseline. Again, if you're younger, this isn't something that impacts your tox treatment as much as when you get older, but we did have that conversation of we want to do some around the eyes just to help give her depressor muscles a little bit more lift and support while we put more units in her frontalis, okay? So super important when you start out to know how each muscle works, if it's a depressor or an elevator muscle. And with the glabella, this is a depressor around the eyes, depressor muscle, and the forehead is an elevator. So anytime we put any type of tox in that muscle, it's going to relax opposite of how it contracts. And so to give her the most smooth forehead, we also have to support those muscles as well. We're doing a lip flip on her because when she smiles, do a big smile for me, you can see how strong her orbicularis oris muscle is, and her lip really kind of goes away. So by doing just a few units of tox there, she'll have a little bit better smile and a little bit more elevated top lip. Good, so I always have them animate. You can see her glabella is pretty strong. So we're gonna do, and then relax for me, we're gonna do 20 units here. So we're starting in the middle and that procerus. It's gonna be a deep injection, and make sure you're low. I see a lot of injectors putting it up here and that is too high. So squeeze again for me, good, relax. I always just have them contract and then I watch where their muscle pulls. And again, this corrugator is gonna be deep the more medial you are. So medial corrugator, we're gonna be deep injection and aim your needle away from the orbital rim. Use your finger to support to prevent any type of tox seeping down into that foramen, because that's what causes an eyelid ptosis. Okay, squeeze your brows again. Good, relax. So you can see here too where her tail of her corrugator pulls. So again, this is a superficial injection. So you can see how I change my needle, and instead of going in this way for a deep injection, I'm going perpendicular to have a white wheel, because that is a superficial injection. Make sure when you're doing this, you're injecting nice and slow. Injecting too fast can also cause some of that fluid to seep down into the levator muscle, which is what we don't want. Okay, so you can see here, look at her forehead. This is her stronger side. So I always have them lift as high as you can. You can see how she pulls a little bit more on this side. Still gonna treat the entire frontalis, but always make sure you look and see which side's stronger, because you might need a few more units on that side. And then with this injection, we're gonna stay deep on periosteum, and we're above that line of convergence. We've talked about this before. And then the closer to the brow we get, we're gonna be more superficial so that we don't drop their eyebrows. So again, if you're up high, you're touching periosteum, raise up high, good, relax. Periosteum, periosteum, periosteum. And then when I get closer to that brow and then relax, I'm gonna take my needle, change it, and do more superficial. And you can see that little white wheel. And then raise up again. Good, relax. See right here, this is her stronger side. So we're doing a few more units here. This is the perfect depth, because you don't want to drop her eyebrows. So still getting these little lines. A lot of times patients, they'll complain about those little commas right above their brows. Sorry, lift up one more time. You can see that right there. And you know, you definitely want to treat these because they'll look funny if you don't treat those. But what I typically recommend is putting more units up high, one, to give them more lift and so that it doesn't drop their brow. But obviously some of that tox will spread and affect that. But still take like 1 to 2 units and place it very superficially above the brow. Don't put it too close to the brow, but if you're like right above it, then you should be fine, and you're just doing, again, 1 to 2 units. Next, we're gonna do around her eyes, her orbicularis oculi muscle, and we're mainly doing this to help give her eyes a little bit more support. So do a big smile for me, and then squeeze your brows. I have them squeeze so I can see where their tail pulls. Get relaxed. And then you wanna go right there, And this is a superficial injection. And we're doing about 3 units at the tail of the brow to help give her some support. And again, these are superficial. You should see like a little wheel, exactly like that. Also want to make sure that you, even if you're treating with less units and light, that you are kind of going around the eye because you don't want to have any shelving. Big smile for me. Good, relax. And that can happen if you only treat like one area of the muscle and then you leave the other area. It can look really weird, so don't do that. So now we're gonna do the lip flip. So we're gonna do about 6 units. I usually recommend doing 4 to 6. If you do more than that, it can look really nice, but they can have issues with talking, definitely using a straw, because again, remember this is the muscle that we use to talk and chew and things like that. So I'm going to show you guys how to do it with 6 units. So make a little kissy face. She doesn't have a lot of the perioral wrinkles, and then relax, but you can still just kind of see where she pulls, and you're just gonna put your needle in superficial and then do a few units, just like that. So we're gonna do 3 on this side, 3 on that side. Sorry, and I tell them this is a little pinchy. Beautiful. So again, we're doing 3 units in total on this side. Perfect. And again, I tell all my patients, like even doing 6 units, she'll think it's weird to drink through a straw, but within a few weeks, it'll be totally normal and she'll have amazing smile and a beautiful result.